Welcome to Socializing Security, where every week we have a discussion about security, compliance, and beyond.
Our goal is to learn and grow by socializing each week's topic with each other, our guests, and with you.
A quick compliance note, this podcast is meant for informational purposes only and should not be considered legal or regulatory advice.
We're glad you've joined us, and we hope you'll learn along with us. And welcome back to another episode of Socializing Security. Milou, you and I have both been working on content individually so far this year. So this is kind of the first time we've been recording, both of us at the same time. So definitely looking forward to an interesting 2026. How about you?
I also just really missed hanging out. Normally we get to just record on a weekly basis, and I can tell and are just planning catch up that I'm I have so much to talk to you about.
Yeah, we haven't really talked about what we've done over that vacation yet either, all that much. So
yeah, that's fair. That'll be on the next whatever planning call whenever I get to see you in person, hopefully for South by.
Yeah. So busy year coming up for sure. So we're actively working on content and stuff. So did some kind of predictions of what we think 2026 is going to be like for cybersecurity. As we looked at those lists, we both were like, hey, these are multiple episodes alone, just based on, some of the outlines that we put together. So we're going to kind of try and tackle one of them a little bit more directly because it is so personal to both of us, is healthcare cybersecurity in 2026. And, as I stated on my solo episode, definitely feel like this is an area that'll continue to get worse before it gets better, especially with the funding sources kind of drying up, particularly in the United States. But globally, it's always been a problem. Funding for healthcare has always been a challenge for them to.
It's so expensive.
Yeah, and healthcare is not cheap, but it is, in my personal view, is a universal need, and therefore is something that governments have a role in. We can debate about what that role is, but it's generally more expensive than any individual can handle, and this is why we have insurance companies and that kind of thing. But from a cybersecurity perspective, it is it is the most sensitive data you have. Is your own health data. Think about X-rays, think about MRI scans, that kind of stuff. Your genetic data. We've talked about that in the past as well. But yet it doesn't have the budget to protect it that it really deserves. And that's the thing that I think I would like to dig in a little bit deeper on. Milou, give me your perspective on that.
This is the first time. Generally, I try to we at Socializing Security here, we do try to, for the most part, we try to be respectful that Brian and I both, we have individual careers, we have our own jobs, and then we happen to do this as kind of a joint venture together. And for the most part, we've always tried to bring in friends to socialize with us and colleagues and peers. And I'll say I'm still very grateful that we've never hurt for recommendations for people to socialize with. It's actually we've been too busy to occasionally get people on the schedule fast enough, which I feel very grateful to say. This is just the first time that we've been recording that I was man, I have somebody that I should really pull in for this conversation, and he happens to be my dad. And so that's a unique thing. My whole family, it's actually unique that my sisters and I didn't go into healthcare because my dad's side of the family, they're all doctors and MDs, and have been for many, many generations. So it's ironic that I now happen to be a compliance attorney that helps companies comply with HIPAA and global healthcare regulations and compliance requirements, because I very specifically didn't want to go into healthcare when I was in college. I was thought about becoming a doctor and was nah, that's not for me. And now I still work with people like my dad. So it's ironic. But I'll definitely talk to him about it and see. I'm sure he would love to come and chat with us about this. And maybe this is one that you two can just chat without me. So, but our background, in terms of that, he's one of the main kind of individuals in Texas, specifically, that has actually done a lot of great for regulatory change for biotech and pharmaceuticals. So, coming up with how do startups, ultimately biotech and pharma companies, actually get funding and investment from the state or from the federal level or from the international level, and how do they do that? That's his whole career ultimately. So he's absolutely the expert in the room who's actually been helping smaller biotech companies, not only in Texas, but all over the world, actually get the right funding so that hopefully their medication and drug can actually make it to the marketplace so that you and I hopefully can use our insurance one day to actually like get those amazing drugs. But
Yeah.
so sorry, that's why I was like, wow, this is the first time I think I've been like, man, I should really call Paul.
A little bit more behind the curtains type stuff.
Yeah, he's gonna
Yeah,
love that.
and I like that angle because I do tend to focus on the provider side of healthcare. So healthcare, life sciences, depending on how you define that area, is multiple different types of companies, and they all have very different needs. And this is all coming from my day job type stuff. Is that we tend to think of hospitals because that's the one we all interact with the most, is the provider
Hmm.
side of things. There's also the payer side of things, which is your insurance companies, which I have a background in as well. So I oftentimes do think about that, but they tend to be more like a financial company in the way that they operate
Mm.
than a healthcare company.
Risk.
But
They're a risk company.
it's about risk, it's about actuarial tables, it's about, how do we define the line so that we can avoid pain as much as possible. Um, but they do still have to abide by things like HIPAA. In fact, that's where I was during the launch of the HIPAA regulations, was at an insurance company, and got sucked into that project. And so there's also the pharma, the biotech. If you go to the HIMSS conference every year, there's what information management is very, very, very broad when you put it in the healthcare context.
Mm. Obviously, life sciences is huge and it includes biotech and pharmaceuticals, but I think also just like coming up with, I think it's like developing the medication ultimately. I think it's like we were talking about the payers and then we're talking about the providers. And then there's also like the developers. In tech is a very different like concept, but it's actually just ultimately like the researchers, the manufacturers, and the actual like companies that are building life-saving medications and drugs that have cured cancer, for example. Like things that we have all like hoped and dreamed and prayed for, that those types of things that have like been able to, we have vaccines and all this stuff. So like I think that part of it is like a really cool thing for us to think about too, of just like making sure that we, tap into that community too, because most of those are startups. And usually they're like the riskiest startups and they are some of the most expensive startups,
Yeah.
because going into clinical trials and actually like what it takes to get into like to get a product to market through like in the US, which is arguably one of the most regulated in the world. The EU has some different standards that are a little stricter, but for the most part, like the FDA in the United States is still really setting the standard for a lot of the medication like requirements. Canada is another leading country as well as in the EU, but for that, like seeing that type of regulatory landscape for me, actually, as a compliance officer, was actually one that was like, oh, I don't know. I don't like tech. I like because it's less regulated. Finance is too regulated. And healthcare, I was like, well, y'all scare me. So
Yeah.
for me to say that as like a cybersecurity and AI like expert is concerning, because some of the startups that I'm even talking to for like my day job, it's like they are doing some of the most innovative stuff when it comes to technology and AI. But given regulation is slow on the tech side, it's really actually like the providers and the payers and ultimately the insurance companies that are actually setting the cybersecurity standards, which we're seeing less of in the tech side. So one of the predictions is absolutely like we will continue to see healthcare pushing the actual standards in the United States for technology regulation, because they're the ones that ultimately like people die.
Yeah.
It's one of the main, people lose bank accounts and like wire fraud and money and finance. But if technology fails on the table in the operating room, somebody bleeds out.
Hmm.
So it is really life or death when it comes to healthcare, which is why I, as a cybersecurity compliance attorney, have always been like, whoa, y'all scare me, because it's
Yep.
very different than somebody hitting a button in a data center and having an outage.
Yeah. Yeah. It's not AWS East going down. It's the ability to transplant somebody's heart is going down. And that is the scary thing working in that space. Like we in IT vendor land tend to lean on ooh, look at how scary this thing is. You need our solution to no longer be scared. Um, and I've always pushed back on that because it's like we need to stop running around scaring people. Like that's not the way to get
100%.
people to want your stuff. And it's a really difficult balancing act in healthcare, because you really just kind of have to walk in and be like, yeah, so that Change Healthcare thing was kind of scary, huh? Let me tell you how we can help there. Um,
It's kind of
because
almost coming
there
from like a supportive place.
exactly. And that's why I love working in that healthcare space with a solution that I actually do believe in. I don't want to talk about it here, but it is something that I feel comfortable saying I can actually help this healthcare company. Like my sister works in a NICU, like and the hospital that she works with or works for just recently became a customer. And it's like that makes me feel really good because now I am
Mm,
supporting her mission. Like
yeah.
I can legitimately say her saving little tiny babies that may not survive on their own.
Mm,
I am in some small tiny little itty bitty way helping to support that.
yeah.
And that makes this job
I
worthwhile.
just got
Like I'm
chills.
yeah, I'm kind of at that point. It's like, am I really doing any good in this world? And should I continue doing this? Because is it a net positive? And when I
Yes,
was
it is a
able
net positive. I'm going to answer
in
that for you right now, 100%. We
in
need
that
people
regard,
like you in the room.
absolutely. Yeah, absolutely. In that regard, being able to say that yes, helping them with that, and you know, as a startup ish type of a company, we're definitely not a startup anymore, but still kind of
Yeah.
leading that innovation side of things. Being able to say like there are better ways to do cybersecurity out there, and what I like to do it from a marketing perspective is not necessarily sell our widget, our thing, but to go out there and say there is a better way to deal with threat actors out there. And here are some of the ways that you can do that. And if somebody else happens to be able to do that as well, great. Like I just want those hospitals to do it the better way and to be able to recover from a situation like that a lot faster.
Yeah.
It just happens that somebody's paying me to help push them towards our solution.
Yeah, I think what's also really helpful when you're talking about like industry verticals and, because that's something like as a founder and like I get questions about that too for certain clients of being like, oh, what do you target? And I'm very broad and I'm a generalist and that freaks people out for the most part. But
Yeah.
I'll say what's nice about when we're talking about healthcare is it is one of the easiest examples to explain to anyone around the world, no matter what language, whatever access issues they have, they can all unilaterally understand what it's like to feel fearful
Hmm.
when you're sick, your family member is in pain, and you need care. And then, for whatever reason, the technology is unavailable. The
Yep.
doctors cannot support it, or like we have all, I think, as human beings, that this is just like a human experience, which is very rare that we can all like universally understand what it's like to lose a loved one or to like understand like hey like the care wasn't enough or like the doctors didn't get to it in time or something like we all know that experience and that's what's actually I think really welcoming about the healthcare industry is that it's really easy to plug into as somebody who's never worked into it because you're
Yep.
like well yeah but like I understand what it's like when I go to the doctor and it's frustrating that I can't log in or whatever like or
Hmm.
like to not be able to access your medical records when you have to switch like providers and stuff. It's frustrating. And so I think it's actually part of the technology space where the end user actually understands the friction really clearly.
Hmm.
Where like,
And the
we've talked
consequences.
about we've talked about many times like, that IT should feel frictionless. And like I think you're the one that told me that years ago before we had our podcast. And I think it was like this concept of like this should feel like you just can walk into a room and like, you for me it's like if you went to a doctor's office and like literally you didn't have to like the forms all work. Like they already have your information. You've like for me that is like a huge sign that they're doing actually what they're supposed to be doing on the tech side. And sadly, the small providers cannot keep up. And that's what's really challenging is we have this really like difficult thing in the healthcare industry too where like these giants are taking over whether they're PE backed or whatever. Like, it's very similar concept to what we're familiar with in the tech space. Is like in the healthcare space for the providers, like all of the little shops, whether that's like individual solo practitioners or like a couple of groups of doctors, are just getting acquired, and it's hard to say no to money. Like, it's hard to say no
Yeah.
to the convenience of like bigger pay, better systems, whatever. But it means too, as individual consumers, the patients themselves, the like options are way limited now. It's like you don't have choice really anymore.
Yeah. Yeah, the consolidation aspect of things. Oh man, so many things to talk about on that topic alone.
Where's Patrick when you need him?
I mean, first off, healthcare is always in a very long time period as technology has become so central over the last 2 decades, let's say, there has always been an element of sharing technologies amongst in the provider space. We're talking specifically now, which then does lead to that consolidation aspect being, it's not just about money. It's sometimes about the systems. Like I can't maintain my own EHR, my electronic
Yeah, and
health
that
record
has baselines in the law, right? Because that's like ultimately what HIPAA was set up for, right? Like the Health
for sharing
Information,
of
like
data. Yeah,
Portability and Accountability Act. It was not only making sure that like providers and pay like insurance companies were held accountable for like transparent billing practices, but it was also making sure that electronic health records could actually be transferred between practices, because
correct.
patients were suffering because they actually had no way to actually get copies of their medical records to easily just go like, hey, like, could you fax this from one office to the other?
Yep.
So that's like where the baseline, yeah, it was tied into like the fight for privacy and making sure that like patient health records and like PHI are actually protected, but really it also was to make sure
Yeah,
that there was less fighting between the
yeah,
different parties in the room.
yeah. I'm old enough to remember getting a referral from a general practitioner to a specialist, and them giving me the records that I had to hand to that specialist. Like that was
That
super
still
annoying.
happens.
It
That's
it,
still
it
today.
definitely does still
Like,
happen.
I still had this in 20. I had it in 25. So
Yeah, yeah. But it's far less now than it used to be. The consolidation, of course, also brings ease to the consumer in some ways
mhm.
because, again, that sharing is more likely to happen if they're all using the same medical records. And so, as I go from the hospital that's associated with the physician's practice that I go to, that's associated with the specialty clinic that I go to, I don't have to worry about the data getting from one to the other because they're all pulling from the same system. So there are advantages to that. That's the advantages that we see with any large conglomeration. It's the advantage of having Facebook and Instagram both under the same company using the same identity provider type of thing. Um, but the
I'm sitting here
downside
being
ends up
like, the risk of.
but
I'm sure you're
that's the
about to
thing
get there.
is, yep, and there's the risk of that. In a situation, and I'm pulling this back to cybersecurity in this regard, if a attacker takes out a health system, and generally it's a health system, not a hospital. So if you're one of those cities that have, hey, we've got 3 different health systems, one has 2 hospitals, one has 1 hospital, and one has 8 hospitals. Guess what? If that one big one gets hit, they're not taking down an individual hospital. They're most likely taking down some amount of the entire system, which means those 3 other hospitals have to absorb all of that coming at them.
Yes.
And that is where it gets really, really scary. Not just, hey, a bigger target means they're more likely to get hit, which means your data is most likely to get lost aspect of it. But when we want to bring it into life and death situations, the just sitting down with a hospital organization and saying, what are you going to do if this thing happens? And have them talk through that and understand the fact that, like, yeah, if we don't have that, then we're back to paper records. Well, paper records mean communications harder, which means we've got people walking around the hospital just to deliver papers, because as they transfer from one part of the hospital, or they need to, we need to look at those x-rays and we need to get a radiologist in there. That all happens, which means that everything slows down. Even if it's still happening, it slows down, which means all of a sudden now they're going to have to start potentially turning people away from the hospital and sending them to other hospitals, because if I break my leg's not going to wait till tomorrow. In fact, it could be worse if I wait till tomorrow. Let's send them to a different hospital. And that rerouting means that other hospitals are now carrying more load, which means now they need to triage and say, we can't do that surgery because we need that surgeon in the ER to handle this uptick. So it becomes this domino effect that can happen that doesn't hurt just one, especially if it's a really large hospital system that gets taken out. And again, that's a bit of the danger with conglomeration of any industry, is that you take one out and you reduce the capacity for the entire world or that entire space, wherever that physical space might be.
There was so much there that I was like trying not to interrupt you on because I was like, oh, I think it's such a messy thing. And for me, it's like really this comes down to like the trust aspect that I think with this conglomeration of healthcare providers and the insurance companies getting pickier about what they want to cover, it has been nearly and really, really challenging to be a patient. I think in these times, I think it's harder and harder to advocate for yourself, for your family members, for your coverages under health insurance. Like I have some health afflictions I don't mind mentioning. Like I'm allergic to like a lot of things, and like even dealing with something like needing common medication like an EpiPen, and how that is so challenging to have, and to even just like doctors are terrified. Like that's the
Mhm.
part that I think we haven't really thought about and we haven't mentioned here, that I think to also just be a medical provider in this current atmosphere and environment, especially in the United States, I think it's really scary because
Yep.
unfortunately, like malpractice claims are going up.
Mhm.
Malpractice insurance policies are more expensive in the same way that we're familiar in the cybersecurity side. That's like, hey, make sure you renew your cybersecurity and do it fast and do it early because it's just going to keep getting more expensive. So
And
it's the same stuff for healthcare providers.
yeah, and another related parallel is the fact that like part of the reason why malpractice is up is because doctors are being asked to do more with less. And as part of the
Yes.
consolidation, they squeeze out, you're like, okay, cool. If we have 5 of the hospitals, we only need 3 doctors to cover that one field between those 5 hospitals instead of having 5. So now they're doing more load, which leads to corners being cut, which leads to
Mistakes.
us not getting the time with our physician that we need in order to advocate for ourselves. They become dismissive and they become very quick to diagnose and move on. So these things are all related, which everybody in IT and cybersecurity understands as well, because we're constantly
Burnout.
being pushed to do more with less
Burnout is real. That's just
everywhere.
being in corporate. I think everywhere these days, I think just having a job, I think it's just hard to just like just be somebody that like wants to do go work these days.
Hmm.
I think I know that I also, because I'm a lawyer, it's harder for me to get care, which is really sad because I'm not a litigator. But I get like, I have no issue saying I've been fired by multiple practices because I'm fairly confident they look me up on the internet and they see my name and they see that I'm a lawyer and that I do compliance and cybersecurity. And I get a phone call from the office manager 2 days before my appointment and they cancel.
Yikes.
And that literally happened to me today. Like I'm supposed to have an appointment on Friday of this week and for life-saving medication, literally.
Yeah,
like,
which is
um,
scary.
and it's really scary. And so, and then it's frustrating because these providers, I've been waiting for that appointment for 3 months.
Hmm.
And so then suddenly you're like, cool. And it's unfortunately like because I have a platform and I talk about stuff like healthcare regulation and understanding how to protect yourself against HIPAA. um, patients are trying to advocate for themselves. Like I have no issue saying like I'm a patient and I like to
Yep.
advocate for
We're
myself
all
and make sure
patients.
that I'm working with the right doctors. But it's also tricky when, you know, doctors and lawyers have never, this is like the amount of jokes in law school where like those two types of people, they're usually like always at odds, which is funny because I
Hmm.
actually help companies, including in the healthcare industry, like actually do the right thing to protect their doctors
Yeah.
and to make sure that they're being mindful and thoughtful of how do they meet access requirements and how can they hit like nail the standards so they can actually go focus on providing excellent care because that's ultimately what doctors want to do. Doctors don't want to be stuck reading consent paperwork and they definitely don't want to be doing like legal work ultimately. Like they don't want to be the
Hmm.
ones that are worried that their patients hasn't signed XYZ policy or XYZ form. They just actually want to do their job.
Yeah.
And so it's interesting that like kind of dichotomy for me, even as an individual person who happens to just be a lawyer, I get fired. I didn't even know that was a thing that doctors did, and it's happened a lot.
Yeah, that sucks. I'm sorry to hear that. As I mentioned before, but
It's fine.
it's
There aren't
yeah,
many of them, luckily, so it's fine.
yeah, and that's the thing with doctors. Like, as frustrated as we all get with doctors, most of the doctors I've worked with sometimes do become contentious because doctors are they're high valuable assets whose time are super valuable, and so for those that have worked in a hospital setting, have worked with doctors they're super demanding. So especially when it comes to IT stuff, like if things don't work, they get pissed and they just want it fixed instantly. They don't have time to wait for it to be fixed. And that is because their time is valuable, but more importantly, I think most of them, it kind of comes down to like, I don't want to be, it's kind of like my complaints. I want it to work. I want it to be frictionless so that I can go do the thing I want to do, the thing that I
Right.
am trained to do, the thing that I enjoy doing, which is go spend time with my patients. And this is one area that I think is really positive in 2026 and it's going to come with a big giant dark interior to the silver lining is AI within the healthcare space, which is one thing I've learned over the last couple of months is that passive listening. So essentially, doctor walks in with their phone and says, "I'm going to record this so that I don't have to look at my papers. I don't have to look at my notes. I don't have to ask anybody else to transcribe this for me. I'm going to use this AI agent on my phone to transcribe it, to look up things for me actively while we're talking, and be able to give you quicker answers while still being able to focus on you, because that's what I'm here to do, is to focus on you." And from what I
Oh, I
hear,
so vary with you on this. So this is one where I'm like, I'm glad you see this as a positive. I, as an individual, I say,
I told you
heck
there was a
no.
lot of darkness around
I say
inside of that
heck
silver
no
lining.
anytime. Luckily, my doctors, they do ask and they do know that I'm
They
like, hi,
should.
yep, nope, I do that for work. Please, no, thank you. And they are required to ask for your consent. It's like protected under the law. Um, Probably globally, I wouldn't say that. I'm more familiar on the US and EU on this one, but they are required to actually have your consent for this, and you can
Mhm.
take it away at any time. So, like, don't feel like if you say yes and suddenly the doctor starts saying weird stuff that you're like, "Ugh, this shouldn't be recorded," you can immediately in that room raise your hand and be like, hey, actually, could we turn that off? Because
Yeah.
I think because like every single major healthcare system has had a cybersecurity breach. Every single pretty much AI agent has had a major security breach. And like, it's very different when we're talking financial stuff, but when we're talking about like PHI, you can't take that back.
Yeah. And again, some of the most sensitive data that you have is owned, is controlled by a healthcare system. And that was definitely the darkness in the cloud. Is the fact that that is very sensitive data. From what I understand, a lot of those systems will take the transcription, it'll take the notes, and it'll delete the audio. So I was encouraged to hear that. But ultimately, what AI is on the back end too, like, is that AI being used for training purposes, or is it just being used for that transcription and nothing more than that? Like, no lack of questions that come up if a doctor
There's
walks in saying, "I'm
so
using AI."
many questions. And the
Yeah,
best part is if you push, they don't know how to answer them. And
I
so,
wouldn't
like,
expect a
that's the
doctor
thing
to.
to me. Well, if they're using a technology, like, Brian, respectfully, for what you and I do for work, if we rocked up to like any like thing and we like brought a recorder out, like even for the podcast, like we have a release form. Like this baseline, like they should have some understanding of, is it anonymized? Is it encrypted? Like they don't need to know the inner workings of that whole like system, but they should definitely have probably like 3 talking points like they do on every single major medication that they're required to prescribe. Like that to me seems like baseline 101. If you're coming into a room and your first thing is that you are told and instructed that you have to ask for your patient's consent to be like, hey, I record. And what's cool and scary to me is that the salespeople that are selling these IT systems are training the doctors on how to say it so that the patient
Mhm.
is more likely to say yes to consent, which I disagree with fundamentally because I think that's deceptive.
That's true for
But like,
pharma reps. It's true for anybody
oh,
selling to
100%.
doctors.
That's their
Mhm.
culture. But like, so to expect doctors not to also be able to like, these are doctors. They go to medical school. They're in school for literally ever. These are some of the
Yeah.
smartest minds in the entire world. No, we need to hold them to a better standard for their tech too.
I agree. I agree with the standard that we should hold them to. I don't agree with the fact that I would expect them to at this stage. Because you've got doctors.
They're using it already.
I know they're using it, but
if they're not using it, fine. But if there are using it,
how many people do you know who use AI that don't know the implications of it today?
But they're not asking you to talk about your like most sensitive information on a recorded line.
No, but they're not any different than anybody else in that regard. Like they're using a tool.
I'm shocked. You're so much more positive on AI. I'm interested in 2026. BK has become like the champion of AI, and like we've swapped. Like because now I'm like, whoa, I'm coming as.
Don't accuse me of being positive here.
I'm happy for you. I'm happy for you. I'm really surprised by the change.
I don't see that as a positive. Don't get me wrong. I don't see that as a positive. I see that as a negative that they don't understand it. That is very much a negative. I'm just realistic about the fact that I don't think they understand it. And I don't think you should expect them to be able to answer that, which unfortunately means you have to.
They shouldn't be using it.
You have to eliminate that tool from their tool belt.
Yeah, they shouldn't use it if they don't know how it works. And again, I'm not expecting them to be able to talk to us about like how like salted like and hashes work and like an encryption model. Like I'm not saying like they need to also be able to like be full cybersecurity experts, but I will say like a year ago-ish at HIMSS, I had some of the most pleasant conversations with actual providers at the Health Information Management Systems Security Conference we've been talking about at HIMSS. And so many of them were coming from a place of, oh my gosh, you're a breath of fresh air. Like we have so many questions about cybersecurity and we don't know who to ask and we would love to learn more because they're coming from a place being like, in the same way that lawyers are too, like lawyers were one of the first a couple years ago when like generative AI was coming through being like, whoa, y'all, like this is not going to be good. In the same way, right, security, cyber IT folks have been saying this for decades at this point, being like, hey, like, this is going to get to a place where computers outsmart us and like that's going to be a problem. I think for me, what was like the main takeaway that I thought again was still really positive about the healthcare community is these happen to be some of the brightest minds in the world and they were all collectively being like, we don't know enough about this and we're also worried about it because for them, it's also really dangerous for them if they now have everything recorded from like a medical malpractice perspective. That part is great for the patients. Like you now have basically a tool that you could weaponize against doctors. But again, it's like, that's not the point of a doctor. Like they're not supposed to be like a pawn in everybody's game. And so like, I still feel for the entire community. And that's part of why the reason, like when I thought about my dream job, I was like, I don't want that job because it's nearly, you cannot win in that job. And so it's tough because you have to advocate for yourself. They still have to always protect themselves, even if they're in a practice, even if they're in a hospital system, because they are individually liable for their own mistakes. And so with something like an AI tool that they don't control, that is now fully outsourced, but has not only like their patient, like their medical, like their actual notes, if that's breached, they're toast. Like they are not working ever again. Like, maybe, and I hope so, but like, we're talking also, like, I feel for them because I'm like, that is an impossible position to be in because if you're not adopting the tech, you're considered outdated and you're probably going to lose your job. Or if you have patients like that are spicy like me, that are like, no, thank you. It's tough because they're already starting to rely on these tools. So they're getting trained in that. And suddenly they forget how to do their like old process. So their processes are breaking, which is also slows them down. And so maybe now they're not hitting metrics, which is also not great. And then on the other hand, it's exhausting because I'm exhausted as a tech and cybersecurity person being like the rapid rate of change is really tiring for me. But what I do is not necessarily life or death. And for them, it is. So I still feel like I feel so much compassion for them, specifically for the actual providers of care, whether they're nurses, doctors, like any of the assistants, like anybody that's actually supporting these organizations. They are doing such freaking important work and it is universally important. And I also I feel sad for them because I would also be like, I don't know what to do. You genuinely cannot win in this whole mess of a situation.
Yep. And well, we can win because I have noted that is a conversation we need to make happen sometime this year as part of our podcast. So we can win by having that conversation and helping people figure that one out. So Yay
I love
us.
this. This is good. Great. We can try our best to bring people into the room and talk to them
Yeah.
about it. Because I mean, like, you and I are always coming from a place of, hey, like we're actively like trying to solve these problems within community so that we can socialize about them, so that we can really hope that we can bring in other experts, other people that have other insights that Brian, myself, and our audience can listen and absorb and be like, man, that was really helpful. And I learned something, whether that had anything to do with healthcare, legal, tech, cyber, IT, whatever we talk about on a regular
Yeah.
basis. It's just healthcare is one that I think you and I both, I think, were like passionate and maybe a little bit more vocal today about because it's so deeply personal. When we're
Yep.
talking about the fight for privacy, this is to me the only thing that matters when we're talking about privacy. Like, as much as like I would love for my social security number and my financial records to not be out there, it's already out there. Like, it's too late. It's already been breached 10,000 times and it will continue to just be out there. So now it's really the game of like, I do the opposite where like now transferring medical records like physically between practices actually helps me sometimes to make sure that people don't get too much information. But that's also exhausting. That was never what the
Yeah.
system, like none of these things were meant for like where we are culturally
Mhm.
at this point.
Yeah. No lack of challenges in 2026 coming there. So, um,
Whew.
clearly why we wanted to discuss it. And we had a lot to discuss there. But I think I'm going to cut us off with the intention of we will have more of these types of conversations about healthcare.
Can we just try our best to both end it on a positive note? Or you can do a
Sure.
negative note because you were so positive on this.
I'm telling you, you're viewing it backwards. I am not super positive about it. I mean, so I'll end it on the same note that I did my 2026 predictions on, which is opportunity. These challenges open opportunity. I hit it for ourselves. Like, we have the opportunity to help people better understand this. And with a mandate of trying to help everybody understand cybersecurity regulations better, we could very well create an episode that everybody can take to their doctor and say, hey, listen to this episode. This is what you need to know about the technologies that you're starting to use or being asked to use. And the things you need to think about. Like, we're not going to answer everything about it, of course, but if I can just invoke somebody to think about it and say, this is serious enough that I need to spend, you know, that week that I have set aside for continuing education, which every doctor has, every doctor, every nurse, everybody in the medical field has continuous education needs. Maybe I spend a day just digging into where AI is in my stack of tools and how I'm going to deal with it. And I would love to be able to be the person that can record something that will invoke them into digging into that, talking to their technical teams about what's going on there.
Yeah, or
How's
even
that for
just coming up
positive?
with I love this. I'm going to just come off of yours where I love that recommendation. And I think we can do something really positive where, I do adamantly believe that any provider, any small business, any company that is using I don't really care what you do for work, needs to understand the protections around it so that any of their clients, consumers, whatever, if they ask and they ask thoughtful questions, they have some answers, or if they don't know how to answer, they know who to reach out to for more information. I think that's hugely powerful.
Yep.
I would love it if we could come up with the quick and dirty like 5 things that doctors should be asking when they're doing, especially when they're chief medical officers and they're CMOs and they're also like actually the ones that are actually making the ultimate decisions for the practice to invest in certain technologies, or what are the 5 things that they have to always ask. I think that's
Hmm.
something that you and I could turn around really easily, and then we could also ask a bunch of our buddies socialize on to being
Yep.
like, hey, what do we think about this list? Do we think this is a legitimate list? Or like, what did we miss? Because I think you and I are both always the first to admit, like, hi, we happen to be subject matter experts. We are not experts in everything. I would
Yeah.
never claim to be a doctor or anything like that. In the same way that I'm sure doctors would not want to claim to be a lawyer, want to claim to be a technology expert, or like, I think a lot of them want to just do medicine and they just want to practice. And we need
Yeah.
to just let them do that more freely within like safe boundaries that everybody, like, because we'll all win. If everybody
Hmm.
feels like safe and trusted within the ecosystem that they're in, we all win.
Yep. Yep. So with that, those of you that are listening and watching, if you know somebody that knows this space well, if you know a doctor that is using AI, like, ask them if they'd be willing to do a podcast with a couple of nerds and talk about the tools that they're using, why they're using them, how they're using them, that kind of thing. I think that would be an awesome conversation for us to have. So info@socializingsecurity.com is your gateway to communicating that to us, or just ping us on LinkedIn or wherever. And we'd love to get those types of suggestions. And I want to have that conversation quite personally,
I
even
do
even
too.
if it's
But I'm
that
like,
type
it
of
might
thing.
need to be like a private one where like, because I'm not sure like a doctor would necessarily feel safe to talk about something like this freely in this type of community, but I do know one who would.
Yeah. Yeah.
So,
Whatever they're comfortable with. Like, even like I mentioned, I'll probably be going to the HIMSS conference in March this year. And if that's the avenue, like if it's hey, go have lunch with this person, go have breakfast, grab coffee with this person, I'd love those recommendations.
yeah, because you could
So
fill us in later, and that way we
for
could
sure.
respect their privacy and
Yeah,
make sure that we're thoughtful about how they would want to show up.
100%. It's all about learning for me. So the more I can learn, the more likely I am to be able to bring good content here. So
All right.
cool.
Thanks for socializing with us. Welcome to 2026. Here we go.
Yep. Here we go. Take care, everybody. Thank you for joining us for another episode of Socializing Security. We hope you learned a thing or two with us.
If you'd like to continue socializing with us on this topic or have feedback, we'd love to hear from you on LinkedIn or social media. Just search for Socializing Security. Or you can email us at info@socializingsecurity.com.
Until next time, stay social and stay secure.